Let's go on study. You just finished the study of pharmacological effects of opioid analgesics. It includes effects on CNS and peripheral tissue. Analgesic effect: sedation, euphoria and changes in mood, and respiratory depression, cough suppression. These effects are useful in some different situations. And MCs just contribute to adverse effects. And meiosis, it is valuable in the diagnosis of opioid overdoses. But the changes of body temperature and hormone release, that effect is very weak. Usually it is not useful. And effects on the smooth muscle, it also sometimes is useful. And the effect on the CVIs, induced vasodilation, sometimes it also has therapeutic significance. But effects on the release of histamine, maybe vasodilation caused by histamine, it is useful, but it's weak. So can you guys, clinical uses here of opioid analgesics include pain, used to relieve pain, cardiogenic dyspnea, cough, diarrhea, and for anesthesia. They are useful. Now, let's study one by one. To relieve pain, morphine is often used to relieve moderate to severe acute pain from various causes, like burning, bone fracture, extensive surgery, post-operative pain, and cancer pain. This pain should be moderate to severe. If it is very slight, mild pain, don't use morphine. And for the constant dull pain, actually the effectiveness is better than that of sharp intermittent pain, but actually used to treat severe and constant pain is relatively suitable as used by morphine. But if it is relatively mild, chronic, dull, constant pain, we also use other preparations to substitute morphine. Just because of tolerance and dependence, even addiction. So these drugs, not only morphine, including other opioid agonists, they have their limitations in their uses. But the pain of cancer and other terminal illness, they can be treated adequately without consideration of addiction, tolerance, and dependence. Now look at it. In the treatment of cancer pain, actually, it is not aimed at prevention of addiction. We just want to make the patients more comfortable by by treatment of morphine. And tolerance may occur, but it don't confuse with addiction. Myocardial infarction, I think you know this disease. It also induces very serious pain in the chest area of the patient, and during that period, usually the patients feel it is so dangerous and very nervous about that disease. It is fatal. So morphine used in the treatment of myocardial infarction, it is very helpful, very useful, because it can reduce pain sensation, and the pain usually has some accompanied intermittent action, the sensation. So some emotional upside can be decreased by morphine because it has sedation, and act on the CVIs. Morphine can induce vasodilation. This for the heart is very useful because for the cardiac disease, it has a significance to decrease cardiac load, after load and preload. Yeah, for the heart, it can decrease cardiac load. It's really helpful. In the treatment of acute severe pain of renal and biliary colic, it also requires a strong opioid agonist and receptor antagonist for adequate relief. Because these colics are very severe pain. Um, that's why it really requires a strong opioid agonist. But don't forget, these opioids also have excitatory effect on smooth muscle. They also can further worsen biliary colic just because of excitatory effect on smooth muscle. So that's why use this strong opioid agonist in combination with M receptor antagonist. They should use the in combination, for adequately relieve this pain. Because M receptor antagonist can make this smooth muscle relaxed from contraction, over contraction. So don't forget this. When I taught you atropine, actually I mentioned this. Do you still remember? Okay, today I mentioned this again, so don't forget. Next one. Morphine also used to treat acute pulmonary edema. This situation is also called by cardiac asthma or cardiogenic dyspnea. The relief produced by intravenous morphine in dyspnea from pulmonary edema associated with left ventricular failure is remarkable. Actually, I hope you can understand what is this situation. This is acute pulmonary edema. Usually, it is caused by left ventricular failure. And the common symptom is dyspnea. So that's why it is also caused by cardiogenic dyspnea. And this dyspnea seems like asthma. And the problem, it also is the cardiac disease. So it also caused by cardiac asthma. Now look at this figure. I think the direction of blood flow in the heart. The problem is in the left ventricle, because of left ventricular failure. When it occurs, the ventricle is unable to contract forcefully and pump enough blood to the whole body, which messes the blood supply of the vital and peripheral organs. At the same time, there are more blood accumulated in the left ventricle. So for the reflow of the blood from the lungs to the left atria, it is so difficult. So the result in the lungs, it often induces pulmonary congestion and edema. Understand? So the common symptoms of this left ventricular failure is shortened, shallow breathing, even dyspnea. Understand? So why morphine can be used to treat acute pulmonary edema? Actually, this mechanism is not very clear. Maybe it just probably involves because morphine can reduce patients' anxiety and fear due to sedation, this effect. And it also can reduce cardiac preload and afterload because of vasodilation caused by morphine and the CVIs, So decrease the cardiac load. It is really helpful. And it has respiratory depression, can decrease the sensitivity of respiratory center to carbon dioxide and relief of shallow breathing. So, in the treatment of acute pulmonary edema, of course, it requires multiple drug therapy. But don't forget, one important agent is morphine. Cough. Here, it does not mean morphine used to treat cough. Actually, suppression of cough can be obtained at dose lower than those needed for analgesia. But don't use morphine because of tolerance, dependence, and addiction. But codeine and dimethamphetamine, these two agents can be used to treat pathologic cough. When you study the drugs for respiratory system, you will study these two agents again. Later, I will introduce this codeine in detail. Diarrhea. These drugs can induce a excitatory effect on the smooth muscle. So it can be used to control diarrhea. But nowadays, we don't use morphine. We just, we have some synthetic surrogates with more selective gastrointestinal effects and fewer no effects on CNS. These are used like a compound camphor tincture or diphenoxylate. Like this agent, when you study some drugs for the GI tract, you will study this again. But pay attention. Diarrhea, once it is caused by bacterial infection, antibiotic drugs are more important. These opioid analgesics, just symptomatic treatment. You should understand this. Next one, anesthesia. Morphine, it also used as pre-medicament drug before anesthesia under surgery. It has a sedation. It can use to relieve anxiety, and it also has analgesic properties. During surgery, we usually use anesthesia. By using morphine, can decrease the dose of general anesthesia. It is also really helpful. Okay, these are the clinical uses of opioid analgesics. So, what are the adverse effects and contraindications of morphine? Let's go and study. Because morphine and other opioid agonists, they have so many pharmacological effects. So they also have many adverse effects. The direct toxic effects of opioid analgesics usually are extension of their acute pharmacological actions, including respiratory depression, nausea, vomiting, and constipation. In addition, the following must be considered: tolerance and dependence. Tolerance. Continued use of opioid for about 2 to 3 weeks results in decreased analgesic effects. In the treatment of terminal cancer, it usually requires a relatively long therapy. So the increase in doses is needed to attain the same physical response. And it also produces tolerance to respiratory depressant, euphoric, and sedative effects. But mycosis and constipation, I have told you, they have very little tolerance. So that's why mycosis is very valuable in the diagnosis of morphine or opioids overdoses. And constipation, it is one common adverse effects in the treatment of terminal cancer. Dependence. It includes physical and psychological dependence. Failure to continue administering the drug results in abstinence syndrome. Once some people have a dependence of opioids after withdrawal, especially sudden withdrawal, they often have some symptoms. The body responds to the withdrawal, like sweating, aches, diarrhea, shaking, feeling depressed, weakness, muscular spasm, feeling of chills in their hearts. They are craving for the drugs. At the same time, they also have some psychological dependence. This drug induces euphoria. Once withdrawn, they have some abstinence syndrome. They are very uncomfortable. And actually, because of dependence, actually we have a period of humiliated history in the past. Now, this picture shows in the end of Qing Dynasty in China, many people smoked opium. They had addiction to the opium. Actually, it is related to Englishman. About less than 200 years ago, Asian China produced silk and very nice China utensils. Chinese sold these productions to the Englishmen. So in England, they have trade deficit. So in order to correct trade deficit, the Englishmen wanted to treat us Chinese opium. So many Chinese at that moment, they smoked opium. They had addiction to this opium. It's so difficult to quit. It was very difficult to quit. So our China, the government of Qing Dynasty, want to refuse this opium trade from England. So it happened first Opium War in 1840s. Actually, many Chinese people, almost all Chinese people, will remember that humiliated history. And they think, now every Chinese will remember this, even very young children. China, we want to achieve a great national rejuvenation. So we remember this. And because of this physical and psychological dependence, so finally, there is compulsive drug use and abuse. So to pursue euphoria, that is a pleasant feeling and freedom from distress or any unhappiness. To pursue euphoria and to avoid withdrawal symptoms, the addicts to morphine often unscrupulously get morphine. Even finally, they rule their life, even rule their family. So, yes to life, no to drugs. Actually, to warn the people to don't make drug abuse because of this substance. Nowadays, This 26th day of June is named International Day Against Drug Abuse and Illicit Trafficking. Now, you can look at these pictures. These opium flowers are so beautiful, but don't taste their alkaloids. Yes to life, no to drugs. Although morphine and opioid analgesics are very useful in the treatment of some disease or situations, and don't forget, they also have their limitation, not only because of tolerance dependence. So remember, if you are a doctor, pay attention to this. For the patients with respiratory depression, chronic lung disease, because of respiratory depression by these drugs, these situations are contraindications. And liver and kidney disease, this drug has a very slow metabolism, and prostatic hyperplasia, and increased intracranial pressure. Also, do not use these drugs. Prostatic hyperplasia, because of this drug has excitatory effect on smooth muscle. It just increases the resting tone of smooth muscle. So it will make the urination resistance further worse. And because of respiratory depression and increased carbon dioxide, it can stimulate vasodilation of the brain tissue. It can increase the intracranial pressure. So for the brain trauma, don't use this drug to relieve pain. Okay, maybe if you can't remember much about morphine, these adverse effects, I give you the tips. Morphine. It induces meiosis, sedation, autophagy, respiratory depression. Because of this, aspiration, pneumonia, hypotension because of vasodilation caused by morphine, and excitatory effect on smooth muscle. So, infrequency of the smooth muscle movement induce nausea, emesis. Okay, that's all for this section. So how about the other narcotic agonist? Go on study. Characterization of individual narcotic agonists based on the activation of the opioid receptors. These agonists can be divided into strong agonists. This group includes morphine, pethidine, and fentanyl, and moderate agonists like codeine, propoxyphene, and some other drugs are mixed agonist and agonist. Actually, they are partial agonists. Buprenorphine, pethidine. Pethidine and fentanyl are the most widely used agents in this family of synthetic opioids. The principal effects of pethidine with affinity for mu receptor are on the CNS. The pharmacological effects of pethidine are similar to morphine, and these effects are mainly related to mu receptor. It has less potent analgesics, and it has a shorter duration of action. Different from morphine, pethidine doesn't delay delivery. So clinical uses of pethidine include: the first also is analgesia, similar to morphine. It is a replacement for morphine. It is used for wound, post-operative, and terminal cancer pain, and etc. But it is not used within 2 to 4 hours before the onset of labor for labor analgesia. Just now I mentioned, different from morphine because pethidine doesn't delay the second stage of labor, so it can be used to relieve labor pain. But here maybe I should explain the process of labor can be divided into 3 stages. The first stage is visceral opening. This usually for the first delivery of the woman usually requires about 11 to 12 hours. And the second stage is the delivery period of the fetus. This is the process of the fetus delivery. So morphine can delay this stage. So for the fetus, it's relatively dangerous. And the third stage of delivery is delivery period of placenta. Now, these are 3 stages of the labor. But because neonates are very sensitive to the respiratory depression by pethidine, so usually we just suggest to use pethidine to relieve labor pain within 2 to 4 hours before the onset of labor. Because these analgesic effects caused by pethidine, it almost just lasts for 2 to 4 hours. After baby birth, after the neonate birth, the effect on the neonates should disappear. Are you clear? Because once birth, the neonate should have their own autonomous respiration. Yeah. Okay, similar to morphine, pethidine also used to treat acute pulmonary edema. It also is a replacement for morphine. Yeah, cardiac asthma. The mechanism of this is also similar to morphine. Do you still remember? There are 3. Because pethidine also has sedation, so it can help the patients to relieve anxiety and fear about the disease. At the same time, it also has respiratory depression, decrease the sensitivity to the carbon dioxide. So it is really helpful to relieve shallow breathing. And it also can induce vasodilation. So for the heart, it has a significance to decrease cardiac load. So this is similar to morphine. And it also similar to morphine. This drug also used in anesthesia. Yeah, same principle. It is used as pre-medical drugs before anesthesia and surgery. Because of sedation, it can help the patients to relieve anxiety and fear for surgery. It also can decrease the dose of general anesthetics. Yeah, it's really helpful. And you have studied clomazine, right? This drug, pethidine, also used in combination with chlorpromazine and propethidine for artificial hibernation. Do you still remember this? Okay, adverse effects of pethidine. These also are similar to morphine, like nausea, vomiting, hypotension, respiratory depression. And also similar to morphine, this drug still has tolerance and dependence, just relatively less and weaker than that of morphine. Okay, how about the other opioid analgesics and how to treat acute opioid overdose? So look at the other opioid analgesics. Codeine. Codeine is naturally occurring opium alkaloids. Compared with morphine, codeine has a less potent analgesic and antitussive action, and it also has less addiction. It is often used to relieve mild and moderate pain. After oral administration, this analgesic effect will kick on-site within 15 to 30 minutes, and it can last for about 4 to 6 hours. Codeine also used to treat acute dry cough, but pay more attention. It should be dry cough. Because of cough suppression, the patient maybe has less ability to remove sticky phlegm out of the airway. So once the individual is suffering from sticky phlegm, mucolytic drugs also are necessary, and only use codeine to control the cough. It is dangerous to induce obstruction of the airway because of more secretion from the airway or sticky phlegm. Codeine also has milder adverse effects than morphine. Fentanyl. This drug is effect also related to mu receptor activation. It has the most potent analgesic effect. It is about 100-fold that of morphine, but duration of its action is very short. After intravenous injection, its analgesic effect will take on-site within 1 minute, and the peak time is about 5 minutes. And the duration of action, it can last for just 10 minutes. So it's relatively short acting. It commonly used for anesthesia and acute pain. And because of its high potency and lipid solubility, fentanyl has been formulated in a long-acting transdermal skin patch. It is usually used to provide continuous pain relief for patients with severe or chronic pain. Methadone. Similar to fentanyl, its action also determined by mu receptor. It has a similar analgesic action to morphine, but longer duration of action. It also has less euphoria and addiction than morphine. In the clinical practice, this drug usually used to relieve serious pain because of similar analgesic effect to morphine, but less addiction and less euphoria. Because of less euphoria, this drug, after administration, it is usually used to prevent the opioid-dependent patients craving for heroin or other opioids because it doesn't cause significant euphoria or other reinforcing effects. And it has very long duration of action, It can be administered once in a day for this purpose. Actually, the treatment of opioid-dependent patients in this fashion is called methadone maintenance program. So methadone is used in the controlled withdrawal of dependent abusers from opioids and heroin as a substitute for the opioids of abuse. Opioid receptor antagonists, naloxone and naltrexone. These agents are competitive antagonists. They have relatively higher affinity to mu and kappa and DIRT receptor than morphine. They can completely and dramatically reverse the opioid effects within 1 to 3 minutes. So it usually used in the treatment of acute opioid overdose. An overdose of opioid, the antagonist will effectively normalize respiration, level of consciousness, pupil size. Naltrexone can decrease craving for alcohol in chronic alcoholics. So it usually used for the patients with alcohol dependence. Okay, that's all for this chapter. In this chapter, I said morphine is the prototypical opioid analgesic, so it is more important than the others. And the other characteristics of like morphine, like pethidine or fentanyl, methadone or codeine, and naloxone. These agents has their own characteristics. You should know this. And pethidine also is relatively more important, especially in the clinics. In situations, it is one important replacement of morphine. So, what are the clinical uses of pethidine? Also, is one important question for you. So, I hope they are useful for your review. Okay, thank you. That's for this chapter. Next time, I will teach you NSAIDs. Another family of the drugs to use to relieve